I started off as an LPN. I went to UDC, University of DC, and the first day of school, I was asked, "Oh, why do you want to be a nurse?" I said, "I'm just here because my parents want me to be here."
So hi everyone, welcome back to my channel. If you are new today, my name is Andy. I am a family nurse practitioner. And today we have a guest with us, Andrea 𝐭𝐞. We are going to talk about our nursing journey yet again. So before we start, I'll just let Andrea introduce herself and just remind you guys that if you have not subscribed yet, what is your problem? Please do, okay? So you can get great content like this. So Andrea, please introduce yourself.
Hello, everyone. My name is Andrea 𝐭𝐞, and I'm also a family nurse practitioner. And I've been a nurse practitioner for over 2 years. And thank you, Andy, for inviting me to this program.
No problem. So, Andrea, you just mentioned that you are a family nurse practitioner, which is so awesome. Can you take us a little bit through your journey about of school? Did you start with your CNA? Did you go to college here? How did that whole journey go?
So I came to the US 3 days before I turned 19.
Oh my God.
I did, yes. So I didn't go to high school here, but I did go to college. I wanted to become a lawyer back home, and when I came,
What?
yes, and when I came, my mother said, "You know what? Like, just go to nursing school for a year." My parents were already here. We'll pay for for LPN school for you for a year, and then just see how you like it, though. I said, I wasn't too happy at first, but then I said, well, okay, I'll do it. So I started off as an LPN. I went to UDC, University of DC, and the first day of school, I was asked, "Oh, why do you want to be a nurse?" I said, "I'm just here because my parents want me to be here." And
Oh my God.
so I was actually the youngest in my class. And I remembered like other people during pharmacology, they will ask them, "Oh, what's this medication?" And there was a lady, I will never forget. The instructor had said something about acetaminophen, and she was like, "Yeah, that's Tylenol." I'm like, "How did you know?" I guess at the time they were like CNAs, or like they already had hands-on experience, which I didn't have. So fast forward towards the end of my LPN school, I had an instructor. She's actually still a UDC. I found her. So I said, "Miss Jenkins, why is it that during the rotation, like you always gave me like challenging patients that my first patient had full blown AIDS, was blind, was like throwing things at people, and those are the type of patients that she would give to me." And she said, "Remember the first day you came to this school? And I asked you, everyone, why were you here?" And you said, "I'm only here because my parents want me to." She said, "Ever since then, I knew that you had the potential, though. And every single challenge that I've given to you, you've handled it with grace and you haven't complained. So, therefore, I want you to rethink the reason why you want to become a nurse, because I see so much potential in you." So, ever since that day, I changed my mind and I put my heart into it. I finished LPN school. It was a 12-month program. And my mother said, "I'll give you a year in this house. You don't have to pay bills," which I wasn't paying bills, but on one condition though. After a year, you have to show me proof that you have registered for school to further your education. So after a year, I went back to PG college, started taking my prerequisite towards my RN. And at the time, I was working in a long-term care setting. So shout out to all the CNAs, GNAs, and the other nurses who really helped me out, because I really didn't know what I was doing in 2021, but they really helped me out. I have a lot of respect for them. So then, I think 3 years later, I transferred my credits to the university, and then I had my BSN.
Oh wow, that is that is so that's such a funny story. And that's actually common. Like I have some people that probably if they were back home would never had become a nurse, but just being here they have, and actually they love it, and they're actually like really great nurses. So
Yes.
I think when you have compassion and you are a really nice person, you will fall in love with it.
I
So
So, and that's the reason why I also became a nurse practitioner, because I saw that there were lots of opportunities, especially with us foreigners or African Americans. There are a lot of opportunities where at the time I didn't see a lot of colored nurse practitioners.
mhm.
And that was one thing that got to me. And I said, you know what? I want to do better, because sometimes the doctors will write orders, and you and I know that those orders didn't make any sense. And when you call them, like, okay, well, what do you think? Especially in long term care settings. So I said, well, I'm almost doing their job. So I might as well further my education and
True,
then get credit for it. And that's
true.
exactly what I did. Signed up for classes. At the time, I was already married. So it was challenging juggling family and going back to school. And I took a semester when I had my daughter. I took a semester off then. I continued. So,
Wow. How was your experience as a student?
so I think it was pretty good though. But when I started taking my prerequisites, that's when I learned that there are certain pronunciations that in the US that if you say that, nobody will understand you. So sometimes I had to repeat myself like a couple of times before my message was understood. So
Oh my God, especially with medications. Like I have learned so much when it comes to pronouncing medication. Sometimes I just give up. But it come oh my God, medication like cholesterol medication, atorvastatin. I still remember the first time I was trying to pronounce that medication to my patient. I was like, atorvastatin. So my patient was like, you mean atorvastatin? I'm like, oh, okay, atorvastatin. That's it, atorvastatin. Since then, I have no problem with
it's
it. Like it's crazy.
it is. One of my co-workers, there was a medication, it was fentanyl. The way she pronounced it, she said fentanyl. I said, what are you talking about? All I heard was, and to this day, I still hear fentanyl. That's all I hear.
Yep.
And
Mm-hmm.
I said, but how do you spell it?
Spell it.
If you say fentanyl, so,
It
so
happened to me too. The very first time I heard a patient telling me that they were using fentanyl, I'm like, what is that? I had to go Google. Like, is it fentanyl? Are they pronouncing it wrong or is it? That's it. I'm like, okay.
yeah, that's what that is.
I definitely understand. And sometimes too, I've seen a lot of providers, doctors, nurse practitioners, white African Americans too, that have problems with the pronunciation of those meds. I'm like, okay, I'm not going to feel that bad. At least I have an accent. English is my second language. If you guys are having issues, then I'm very much okay.
Yes,
I'll
yes.
take it like that. All right. So, what about before we talk about your experience as a family nurse practitioner, how was your experience as a nurse working on the floor?
So my first day at work as an LPN when I started, the supervisor took me to the unit where I was supposed to start my orientation. When they say it's your own people,
I will do you.
try to bring you down, that was real. So this lady, she's still at that facility though. She was an LPN, but I guess a seasoned LPN. She blatantly told the RN supervisor, no, I don't have time for this. I don't have time for new grads. I still remember it to this day. So that made me realize that, okay, I don't want to be this kind of person. I don't want to be this kind of example. And I worked my way hard, and I learned to respect the CNAs and GNAs and my co-workers, because even when I became an RN, the techs of the hospital, they always made sure that when I worked with them, like, we were all good. We all finished, completed our shifts at the end of our shifts, like, we complete everything on time and the task is done, and we take care of the patients and everything. So having that respect, because some of them have a lot of experience.
Yep.
An example was when I was a new RN and I got into a hospital program where it was for new grads. And I think that was my first week having patients on my own. And one of the techs said, she's an elderly African lady. She said, "Oh, that patient is about to have a seizure. So you better get all your medications and everything together." It was a good thing I had learned to respect those people, like, trust them. Less than a minute, this patient started seizing.
Oh my God.
And by the time I got the medication and came back, she had already positioned the patients and everything. All I needed to do was administer the medication, and yeah. And even now, when I do rounds, like, with different settings, like, I help, whether it's the nurses or the CNAs, because it helps. And these are the people who see everything, they know their patients better, and when they say something to you, you have to listen. So that has helped me a lot in my career, whether it's from being an LPN or an RN, all to this day. Even the MAs, the medical assistants I work with now, they're very knowledgeable.
Oh yes.
Yeah.
Oh yes. The best thing that can happen to you is having an MA that is seasoned and know what they're doing. Your
Yeah.
life will be easy.
I think just respecting everyone and, like, accepting everyone's roles and responsibilities, and having that what would I say? Having right, just respect for everyone. It helps a lot, because we won't know everything, no matter how much experiences we have in it. So it helps, and just teamwork.
Yep. See that teamwork spirit. That's
Mm-hmm.
the best. Teamwork spirit. I remember when I first started at my job, right? So I'm I'm used to being hands on. So if I want to do something and maybe my MA is busy, and I don't know, I feel weird sitting down waiting for her to finish what she's doing to go and maybe draw blood. So I remember the first time when I first started, and I just took my this thing, I started doing my, oh, at first she was like, what are you doing? What? She was worried. She was like, what are you doing? Are you trying to do my job? I'm like, oh my God, I'm so sorry. No, this is how I work. If you're busy, I'm going to do something. I can't just sit there. I was drawing blood. And then she eventually got used to how I work. She's like, oh, okay. Because, sometimes when you do that, they think you're going to go report them and say
Yes.
they're not doing. I'm like, we're going to work together. I'm not going to sit down when you're busy. I learned how to schedule my patients. If my MA is busy, trust me, I'm going to schedule them and send them going. If I need to do A1C. If my MA is busy with another patient, I will do it. Even when I transferred my clinics, because I transferred my clinic, I still work for the same company. I just transferred location to a place way closer to my house. So I remember the first time I asked them, show me where you keep your A1C stuff. My back A1C, they were like, whoa, whoa, whoa. I'm like, look, I've been doing this. All I need is, where do you keep it here? Let's just move on. So when you work together, it makes everything, like, your day will be smooth, and you go to work feeling, great.
And I tell people also, in order for you to be a good leader, you have to know what to do. In case your MA or your whoever calls out, you know what to do. And that's one thing I try to do with every job, like, try to learn everyone's roles and responsibility and know how to do your basic things. Because even with family practice, you can have a 2-year-old child who's refusing a needle stick. So I can easily say, okay, well, while you're doing the assessments and mom is there, like that initial stage, draw my own blood. And as you said, sometimes the MAs are like, this hasn't been done before. But I think what makes us unique as nurse practitioners, that we're not only providers, healthcare providers, but we're also nurses first.
Nurses, yep.
So you're hands on.
Especially when you work with physicians, they will not touch a thing. So when you want to do something, they are so confused, like, what are you doing? But, like you said, being a nurse before has already trained you. And most patients actually love nurse practitioners as their providers. I,
Yeah.
I had a patient that was assigned to a physician, and I just happened to see her the first time. So I was like, somebody else is your provider to your next appointment. She was like, a doctor? Oh, no way. So I was like, why? She said, no, I don't do well with doctors. All my providers are nurse practitioners. I had a doctor once and that didn't go well. So I've always had nurse practitioners. They are so nice. They are very attentive. They are very caring. I was like, okay.
It is. But I actually have a family member who had a physical exam. I think that was like a few years ago in December, and then I think like 2 months later, she was complaining. She said, "Oh, one of her breasts feels sore. Like there's just something wrong, and she doesn't feel good." So I said, "Okay, I'll just call your primary care, your doctor back, and just let them know." So the doctor said, "No, you had your mammogram 2 months ago. You're fine." So she called me. She said, "I said no. You know what?" I said, ask them to see if they have a nurse practitioner." But another thing I've learned with us Africans also, some of us don't trust nurse practitioners because they're like, oh,
Yep.
she's just a nurse.
Not a doctor.
Not a doctor. That's the thing. So just a nurse. So she said, why? I said, just for second opinion is the same practice, like just, stage 4 cancer. As soon as the lady saw her, yeah, within 2 months. As soon as the lady saw her, she said, no, this is just not anything, just not a pimple and everything. She sent her for a biopsy, everything. Yeah. Within a month, she started chemo and radiation. Yep. She had to go through it.
Yeah, I have goosebumps.
Yeah. I think that's we listen more though.
Yeah.
So
Wow. All right. So, as your what about your experience now? We've talked about your experience as a nurse. We talked a little bit as a nurse practitioner. So, what have you seen so far practicing? Do you compare to nursing, working on the floor? What is your pros and cons?
I think being a nurse practitioner, at first we used to say, oh, providers, all they do is they just sit on their computers. They don't want to get up. They don't want to do anything. It's a lot of paperwork, a lot of critical thinking, a lot of phone calls, a lot of education, patient education, staff education. It's a lot of work. But as long as you love what you're doing and you're always doing your research, you're always reading on new things, that helps. So I would say there are lots of cons, but one of the challenges I would say that I do have is, as I mentioned before, sometimes with foreigners or Africans, like sometimes they just don't take you seriously. That's it. So I had a lady who, the daughter was either 14 or 15, and she came in for her physical. The mom wanted to be there, but the daughter was making eye contact to me, like, okay. So I asked her, I said, is it okay if your mom is here? She said, yes. She said, yes, but she's shaking her head. So I just asked the mom if she could step out. So she said, no, I don't want to step out. And you can ask my daughter said I can step. I said, well, just step out though. I just need to ask her a few questions. So she wasn't up to date with her HPV vaccine. So when the mom came, I spoke to her. She said, you can't make my daughter promiscuous, so she can't take HPV vaccine. That will make her promiscuous.
Oh my God.
I didn't know if I should be offended. So I
Oh
said,
my
ma'am,
goodness.
it's not about being promiscuous. So I started explaining to her about the HPV vaccine, how they've had success rates even in countries like Rwanda and things like that. She said she was going to think about it because it's going to make her daughter think it's okay for her. It was a whole drama over HPV vaccine. And I think my challenges, well, later, like a few months later, she did bring her daughter. Then her daughter is up to date with her HPV vaccine now. But it's things like that. Or you talk to patients about substituting. Okay, well, instead of using cassava fufu, you can still eat your stew and your egusi soup, but you can substitute with oatmeal fufu, or you can even use cauliflower and
Mhm.
things like that. Some of them are just non-compliant, and they, oh, you're too Americanized, ma'am.
Oh God. Oh my God.
And they're quick to tell you, oh, now you want to behave like, oh, you So sometimes you don't even know if you have to, if you should just laugh, or, and it's hard keeping a straight face sometimes.
My people, my people.
But once you start explaining to them that, look, this is something I do too. These are the challenges I have experienced. I'm not telling you to do these things because I want you to. I just want us to be healthier. You have to live to see your grandkids. You have to, most of the time they come around.
Education, education.
It's a lot of education is needed in our communities. A lot.
Yeah. Even with high blood pressure, now I'm seeing a lot of young African and African American males with high blood pressure because they're just not taking good care of themselves. And it's just even sometimes you're explaining, and it's like they just can't get. I've literally had someone told me, you're not going to make me take medicine.
Mm-hmm.
All you guys do is give medication. I'm like,
Mm-hmm.
if you can change your lifestyle and get your blood pressure down and your A1C down, then you won't even need the medication. How about that? So, what can you do for me there? Some people will blank out, refuse. A1C is greater than 14%. Oh, no, you can't make me take insulin. I don't want insulin. Okay. What can you? So, what I've found that has worked for me is okay, I'm just here to support you. Ultimately, everything is in your hands, your health, your power. You do whatever you want to do. If you want to go blind, because one day, let me tell you, you wake up and you're blind and you're looking at me like, I say, yeah. You want to go to dialysis, start going to dialysis three days a week because high blood sugar will destroy your kidneys. It
Mm-hmm.
will destroy your heart. Oh, I didn't even know that diabetes caused all this. I say, yes, sir, it does. So honestly, I will support you, whatever you want to do, but at the end of the day, it's your choice. You have the power to go. But once you putting everything on them, they're like, oh, okay. Now they start coming. Okay, I can try the insulin for 1 month
Mm-hmm.
and see how it goes. So yeah, our community needs a lot of education, a lot of patience. So yeah, it's
Mhm. And I think the other thing is when recently I was talking to a friend, she's back home and she was telling me about her neighbor. She said, oh, everything is so bad right now that even the neighbor died a few days ago. She just opened a restaurant, a bar and restaurant. And she went to the back, like around 5, 6 o'clock. She went to the back and she was just saying, oh, my head. And then she fell down and that was it. She died. She said, oh, she was a healthy lady and everything, and I started laughing. She said, oh, but what's so funny though? I said, the lady didn't die because I'm sure it wasn't because of witchcraft, because you're saying that because,
oh,
oh, then she opened her restaurant, bar and restaurant. Now people are
people start hating on her, jealousy.
I said, has she ever complained of headache? Do you even know if she had hypertension? Do you know if the stress of opening that restaurant and having
Mm,
all of this, like people and financial responsibilities and everything, she has to stay up late at night now till 2, 3 in the morning, get up again at 7, 8 o'clock. Do you know if she had hypertension. Did anyone ever check her blood? She said, oh, I don't know. I said, so before we say all these things, we have to look at the environment also and see if all of those things were contributing factors. She said, well, that's the same way her mother died. The lady's mother died. So then I just stopped talking. I said, you know what? This is a fight for another day. I am, no.
Yeah. It's so sad. Even my own dad, when I went home, taking him to go do a full workup, it was a lot of conversation. I told him, I said, you can just sit down one day and you fall down, brah, and die. And that was like, what? I said, well, that's what happens if you don't take care of yourself. You don't know what's going on with your body. If something is going on, you can take medication, and you don't know what's happening. It's like, oh my God, that's how one man like that was just sitting down, and just fell down, dropped down dead. I said, that's how it happens. Just drop dead.
And sometimes it takes that reality check for us to say, this is what's going to happen to you. Like you tell patients, take your hypertensive medication. Oh no, I don't want to take it. Half of the time I already know why the male patients don't want to take it. And I said, well, when you die, someone else is going to take care of your wife. So if you take that medication right now, thinking of erectile dysfunction, when you can take medications for erectile dysfunction, someone else will take care of your spouse. So think about it. You're giving your spouse a free pass, basically.
And if one medication does not work for you, you can always, some of them, they just stop. Oh, this is what it did, so I just stop. No, just let us know that this is what happened. Let's try something else. Some of them, I've seen a lot of Africans, a lot of Nigerians that I've had as patients. Oh, I'm so busy at work. I work how many? 16 hours. And then I come back. I just don't have time to come. I say, let me tell you something. If you die today, your job is going to hire somebody to take your place. They're not going to sit there and mourn for you or keep your position open because you were such a good employee. They will hire someone else and replace you like this. Your health or your job, which one you pick. And when you do that, and they're like, oh, you're right. You're right. Of course, I'm right. Take care of yourself. So it's just a lot of education. And there are some of my patients that I see on my schedule. I'm just like, oh God. I know that it's gonna be a lot, and I have to prepare my mind.
Yes.
To go in, just knowing that I'm going to have a lot of discussions today, a lot of education, a lot of redirecting, a lot of trying to convince, to do the right thing.
Yeah.
So it's really, really, really a challenge among the Black community. Same thing with getting your vaccines. You don't even want to go there.
So now I'm also into public health. And that's one of the reasons why I went into public health. So during the just the beginning of the pandemic, I had an opportunity to join one of the jurisdictions health departments. So when it was time to get our COVID vaccine, we were like the first set of people who received their COVID vaccine. I had family members who were like, oh, you want to be a guinea pig? I hope you have life insurance. Like, you're going to die. You're going to turn into a zombie. And we did a lot of education. So when I got my first vaccine, it wasn't from a Black provider. It was from a Caucasian provider. She gave me the vaccine. She never explained anything like, okay, well, she never said anything about side effects, possible side effects, or like your arm will be sore, or like, she never said anything. She just gave me the shot. You have your COVID vaccine. Boom. She gave it to me. She put the band-aid. That was it. Okay, your next one is doing 21 days. So you're coming on this day. So I said to myself, and I went back to work and I said, we have a problem.
Yeah.
Because if these people know who we are when they administer the vaccine, except maybe she assumed, but even you can't even assume, this was a pharmacist. You can't assume that I already knew the side effects or possible reactions and everything. You never gave me any type of education. I said, if we're trying to promote this vaccine, we have to give people the chance, like people who look like us, people who look like our population, have to administer those vaccines and do the education. Because I'm telling you guys, I am not going to go back to that site to get my second dose. I am not. And if I feel that way, imagine what the common person will think.
Someone that wants answers, like you're giving me this, what am I supposed to do? What do I expect?
And I was scared though. I was scared because I didn't know anyone who had taken the vaccine at the time, but I had to put a brave face on. So I think a lot of education is needed with when it comes to vaccines. But one thing I'll tell you, Indy, I think some of these religious leaders, the government should charge them though, or some of them should, because some of them do take the vaccines, especially like the COVID vaccine, and then they will tell their followers or the members, "Oh, don't take it because it's against religious beliefs." But then you and I know that most of those people are up to date with their vaccines, or at the time we're fully vaccinated with their whole family, but yet they're telling their members, "Don't take it." And
which is why it's important that people know their God. Know God for yourself and have your relationship with God. So whatever someone tells you, you go talk to God about it. Ask him, should I take this vaccine or not? You just don't follow somebody blindly just because they are your, pastor or whatever.
Religious mommy.
You should know God for yourself. And if you don't have, if you have faith enough, strong faith, to say that if I take it, I don't want to take this vaccine because I have faith in God. That's fine. Totally fine. But if you don't have enough faith, you're not strong enough on your own, you're doing it because somebody is saying it. When you die, that person is still going on over there. God forbid you go and contact the virus and maybe your body cannot handle it well. You're going to die. And when you get to heaven, guess what God will tell you? Did you ask me? Didn't they give COVID vaccine? Why didn't you take it? I gave man the wisdom to make the vaccine so you can survive. But you didn't take it and you didn't talk to me about it. And you didn't even have enough faith. Well, you weren't supposed to go now. You left early. Welcome. Here's your seat.
So that's another challenge in our community though. That's my religious leader says no, it's against, so
and not even only that, also with the talks, what is that thing? Talks, can't even remember. 𝐥𝐤𝐤𝐞,
the Tuskegee Airmen,
right? So
with the
that thing caused a lot of issues among Black Americans, because I've had a lot of patients that because of that they keep bringing that up. Do you remember what happened?
The syphilis was
Black people, and some, like, you take the flu vaccine. Why do you trust them? They are the same people that make the flu vaccine. Why do you trust them to take flu vaccine, but you don't trust them enough for COVID? And they're like, oh, because it's COVID, just the vaccine is way too early. He didn't go through the whole process. There are some people you talk to, and there's an an opening that you can see that they just need an education. And there are some people that their minds are just so shut down. You can't go anywhere. You can't.
Like I tell people, COVID is not new though.
Yeah.
It's COVID-19, like 2019. So COVID is not new. When you check all your vaccine supplies from years ago, those labels have COVID on it.
Yep. Yep.
So.
All right. So, what advice would you give a young African or Black American seeing what is going on in this field and having the knowledge that you have now? Any young African American girl, boy, woman that wants to go into nursing, what would you advise them?
I would say they should go for it though. with their hearts, because once you put your heart and soul into it, it's very honorable. It's a very honorable profession. It is. For me, just seeing patients who, from the first day you saw them, either they were in coma or they couldn't even walk or do anything for themselves, and just seeing that recovery, how they progressed through time, knowing that you had a lot to do towards their progress, that's very satisfying for me. Yeah. Even though we might be a nurse and the doctor prescribes all the medications and all those things, but the hands-on talking to that person, how you make them feel, it helps. So nurses play a great role in recovery. So I would say I wouldn't change my profession for anything, even though this wouldn't have been wasn't my first choice growing up. But I wouldn't. I've had the opportunity to go back to school to be a lawyer that I wanted to, but that's not what I want to do. So put your heart there, be focused. There's a lot of studying. I know that especially with us Africans, like back home, people think that, oh, nurses are just dropouts, that's why they go into nursing, but it's not the same here. Try those statistics classes for prerequisites, or your chemistry classes, or your physics classes, or microbiology, or nutrition. So put your heart, study, and do your best. You might never know the patients that you might see laying on that bed today. Tomorrow, you might find out that they're the CEO of whichever company or whichever hospital that you might be applying for a job. And it's just a small world. So I love it, and we just have to keep pushing each other. And I know in the past, what we usually say, nurses, if they're young, as a seasoned nurse or as a nurse practitioner now, we also have to help the young ones or the up and coming nurses or nurse practitioners, because it helps a lot. So if we don't help them and they don't look up to us as a role model, then that's not a good look for our profession. So we have to encourage the young nurses or people who want to get into the profession. And I'll say, if you're getting into the profession because of money, you're gonna hate it. And
I was about to ask you that.
Okay, the job, you will hate it. You will hate it. You will hate it if you're getting into this because of money. You have to love what you do. If you don't, the slightest thing the patient says will trigger you. And no. And people say, oh, nurses make all this money. That is not true. Even if you make the money, you have to put in the work and you have to put in the hours.
You work for every penny.
You will have to. So
yeah. And with nursing, honestly, if you don't love it, if you're not a compassionate person, you're going to suffer in nursing. And because there are some, especially working in a nursing home, starting by the time the patient will also, by the time they finish cursing you and calling you all types of names, you understand that it's really not about you, and you have to have a thick skin. At the end of the day, you still have to take care of that patient. So nothing will teach you, nothing will humble you.
It will humble you. It will humble you. It will really humble you. It will.
Yeah. It's a beautiful profession, but if you're not a loving, compassionate, caring person, it is absolutely the wrong profession to be in. You're gonna hate it. And even for me, I think even transitioning from nurse to family nurse practitioner, I think I still enjoyed that patient interaction, because they would tell you so many stories, like, honestly. So again, you have to love it to do it, or else you're doomed.
When you say patient tells you stories, I had a lady who she was a Jewish lady. One day she saw me, she said, I don't know why you keep wearing all these cheap shoes. you, this lady has Chanel shoes and everything in a nursing home. She will be dressed up every single day. She'll be dressed up with red lipstick and everything. She said, you know, let me tell you something. She said, you walk a lot and your feet makes you money. Like, that's part of your profession. You have to stand on your feet. She said, buy good shoes, expensive shoes, shoes that will last. And it will help you, and your profession and your career will go longer. And guess what? I stopped buying all those Payless shoes. all the shoes that will be color coding with my uniform, my scrubs. And I found out that when I wore good shoes with good support, they lasted longer. They were much more expensive, but they lasted longer though, and that helped my back. That was comfortable.
Things you wouldn't even know patients are looking at.
Patients are looking at you and they tell you.
Everything matters. Some of them, they love, I remember back in nursing home, they love those colorful uniforms with like graphics and different stuff. It just makes them so happy, you know. So you can tell we love nursing.
I know. And I love long-term care though. For some reason, I don't know why, I just love long-term care. Like, let's go back with all those stories, listening to those people. Some of them have really interesting stories.
Yep. Yep. I used to have one patient that will not sleep at night. He would stay up all night. So it was always a problem. During the day, he would sleep through breakfast. So one day I asked him, I said, every time I come in, I keep getting report that you don't sleep at night. What is your deal? I now found out that he used to work at night. So his body, everything is used to staying up at night and sleeping during the day. So I was just like, okay, that's just how he is. Just understanding, just talking, and you know. So anyway, we have come to the end. Thank you so much. We have gone 42 minutes already. Just like that. Thank you so much. This was so awesome. It was so nice reconnecting, you know, and just again, you never know who you meet in this nursing field, because we met in nursing and here we are. We went at different paths. We went to do nurse practitioner. I went to do nurse practitioner. You know, like this world is a small place. So that's why you're always nice to people, because you never know. You never know. So thank you so much for joining. Definitely we'll do something else together again.
Oh, definitely. Definitely. Okay.
Thank you so much. Okay, until next time.
Thank you.